Got it? So if they make 2 mistakes, you count that line and you subtract 2 if there were 2 mistakes. If there is 1 mistake that they made on that particular line, you subtract 1.
Oh, okay, okay.
Yes. So let's say, for instance, you were doing line number 9. Line number 9 is 2020. That is a normal vision. That's like excellent vision. So let's say that they did go to that number 9, line number 9, but they only completed, they have 2 errors on that line. So 2 letters they did not correctly. So then we don't tell them, hey, you made a mistake right there. Oh, you have 2 mistakes. No, we just let them run the whole line. And if they made 2 mistakes, because we need to be aware of what they're doing when they are reading, we are following exactly what they're doing. And if they make 1 mistake, so instead of just writing down vision acuity 2020, we're going to write down vision acuity 2020 minus 1 if they make 1 mistake. If they made 2, we're going to write down 2020 minus 2. That is it. That is up to 2 errors that they can have. But no worries that when we go back to the school, I'm going to show you how it works with the chart and things like that. Okay. So this is not something, simple. It looks simple, the test, but when we have to do it, we need to know how to do it. And when we have questions in the exam, it is a good idea that we actually know what we're doing and how we're responding the questions. Okay, Alicia?
Okay, thank you.
Yeah, no problem. Welcome again for those who just joined the class. Okay, so let's continue this new chapter for this medical clinical laboratory. It's not that you're going to be doing all these procedures. Most of the time it's because you're going to be assisting the medical doctor or probably the nurse to do these procedures that we're going to see next. Now, these procedures are simple. I did some of them as a medical assistant. But things have changed and then. You see, I did this in 2000 to 2004. That's the time that I was a medical assistant. So I was allowed to do certain procedures, like for instance, the irrigation. But I was taught by someone, that knew what they're doing. And these procedures are very simple. They are called therapeutic procedures because therapeutic means treatment. We just do something very simple because if you are irrigating the ear, it's because the patient has wax in there. So that's basically what it is. So if you do the procedure and the wax doesn't come out well, you're not going to hurt the patient anyways. So for that reason, medical assistants are allowed to do it if they train you correctly how to do it. If the policies of your organization allows you to do that. Most of the time, medical doctors do that. You just have to prepare the equipment, be there to assist the medical doctor during that particular procedure. That's basically what it is. But the point here mostly is because most of these questions comes on exam, so you need to know the procedure, even though if you don't have to do it. But then if you have questions and we don't go over the procedures, you're going to miss this opportunity to get these questions, these answers right. And then, probably not going to be doing well on your test. So for that reason, we have to cover this. It is part of the curriculum. And even though, once again, you don't have to do the procedures, still, they're going to show up on your exam. Okay, so let's start with the first procedure, irrigation. Once again, is a very simple procedure. You actually can do it at home with your family, with your friends, because it's not a big procedure. You don't need like a very special equipment, so to speak. You just need a syringe. You need a basin, of course. You have these non-sterile gloves, clinical gloves, couple of containers there, and then you're gonna do it because you're gonna need some type of, you just go to the pharmacy and get distilled water. So that's basically what it is. Can you use tap water? Yeah, you can boil it and let it cool down, and then when it's cool, not too cool, but like room temperature, now you can do it. So that's basically what it is. It's not a big deal. But in the medical, most of the time, we're gonna make sure that whoever does these procedures is someone who knows what they're doing. So that's basically what it is. Remember, there is no compromise, no risk of damaging anything with the patient. So nothing is going to happen. This is like actually drawing blood is more complicated. But still, when you draw blood, you're not going to put the patient at risk for anything. Unless, you are reusing somebody else's needle. That's a different issue, but that's something that you're not going to do. So what the first question for exam, so when you're doing an ear irrigation, remember, it's just flushing the ear. So how do you know that you have to do a ear irrigation? Very simple. Remember, the patient complains about having something in the ear or that not being able to hear from that particular ear. I can't hear from this ear. I feel like something is in there. I don't know, but you need to check it out. So that's basically what they tell you. And that's the reason that they're. It's not someone who has a medical condition that they are losing their hearing due to age, due to trauma. Now, if they said, I cannot hear through this ear and I have a blow with something, somebody hit me, now that is not something that you're going to go and do an irrigation. Of course not. So we're going to go through the process and you understand how it works. So the first question that you're going to have from what is cerumen, by the way? This is the medical term for wax. So whenever you've been asked, what's the most common reason the ears becomes kind of clogged or, block, if you will. So that is because of the excess of cerumen. That's basically what it is. So look for cerumen because it's the same as earwax. That kind of brownish stuff that sometimes comes from our ears. Sometimes you use the Q-tips or your finger or something else and you feel a little crunch canal, so that is called cerumen. Remember, that's a question for your exam. When you do an irrigation, one of the most common is excess of cerumen, earwax. Remember, cerumen means earwax. So if they are remove wax, what exactly you are removing, and then the choices you're gonna find cerumen, that's the right one, or vice versa. You as the medical assistant have been ordered by the medical doctor to do an irrigation due to cerumen blockage or excess in ear canal. So then what exactly the medical assistant needs to remove, then you look for wax. earwax. Basically, that's what it is. So it can be something else. So before we actually go there and try to irrigate the ear, the first thing that we do is the medical doctor, the nurse, someone else is going to check the ear, because remember, the patient is going to be seeing the doctor first, and the doctor is going to decide whether someone is going to be doing the irrigation, because remember, the patient complains about something, they're going to see the doctor first. The doctor is going to use the otoscope. It's going to look right there through the patient's ear canal, and then, because they're going to say, my right ear, I have problems, I cannot hear from this, the medical doctor is going to do check that out over there. But it's not just that ear. We check both ears, regardless whether the other ear, the patient is not complaining about it, because we need to compare ears. People have sometimes medical conditions like ear canal defects. So it might be something else. So we need to check both ears. So after that, the medical doctor said, oh, you have lots of wax over there. So if the medical doctor allows the medical assistant or the nurse to do the procedure, they will direct this patient right there to you or to the nurse. But remember, the medical doctor will examine the patient first to determine exactly what is the problem that the patient has. Now, if there is something else, see, the patient has a foreign object in there, like a cotton ball. Remember, sometimes, the little cotton balls from the Q-tips, they fall off, they detach from the little stick because you're moving it too much over there, or who knows, or the patient makes their own Q-tips. They have a kind of cotton ball or something else, or a piece of gauze, they roll it up in something and a little stick, they put it in there, and that thing, because it was not secure to the stick, is going to detach and get stuck inside the ear. And now you're scared because you cannot get it out. Or you can have actually insects there. You can have a cockroach, you can have a tick in there. So some of the stuff happens. Little kids put little stuff right there. They put it in every opening, like nose, ears. So medical doctors examine the patient first. If they notice that is something that needs to be done by them, then immediately that's what they're gonna do. So it's not like they're gonna call you and says, okay, you, Albert, go do an irrigation, like out the blue. No, it doesn't happen that way. They get someone who knows what they're doing. If they don't have someone who they have trained already on the jobs, then the medical doctor is gonna do it. Or if there is a nurse, they're gonna put the nurse to do it. So that's basic. But you have to assist them. That's basically what it is. And this is what you're gonna need. Remember, you're gonna need the syringe, because that is the place where you're gonna, fill it with the liquid, with the irrigating solution. That most of the time is the still water, and that's it. You're gonna place it right in there. You don't have to mix anything else. It's just this irrigating solution. That is it. Then you have a drape, remember, like that blue shack right there. So that's basically what it is, just to place it on the patient's shoulder so the patient doesn't get wet. So that's basically what it is. So those are the supplies and equipment that you're gonna have. Now you're gonna have a basin. Remember this little structure right here, this container has little indentations in both sides, because that's the part that is gonna go. It's gonna be placed right underneath the ear. So when we are irrigating, that container needs to be placed right there by the ear. The patient can be holding it, or you as the medical assistant, if you're not doing the procedure, you might be the one who's going to be holding that basin right there close to the ear that is being irrigated. Of course, we have here another container, a sterile bowl, because here we're going to place this irrigating solution. We're going to have gauze. Later on, we're going to see why we're going to use the gauze. Remember, when they remove or they drain the ear, the ear still contains some of the little irrigating solution. We don't want that to be draping on the patient's clothes, shoulder, neck, or whatever the case may be. So we just place these gauze right there by the ears opening so it can absorb whatever excess of irrigation or irrigating solution we have placed the patient inside the ear. Remember, for these procedures, we wear gloves because it's part of the standard precaution. So that's basically what it is. Now, if you see right here, once again, you're not going to use this otoscope. It's going to be used by the medical professional. It could be a a nurse or medical doctor. They can be doing this. Remember, it's an otoscope. Remember that when we went over those instruments, I told you that they're going to ask you during the national exam which instruments you are going to use to look or to evaluate, to examine the ear. Otoscope. Remember, it's an otoscope. You can say otoscope, but all depends how you want to pronounce it, but mostly in America is pronounced otoscope. So that's basically what it is. So we're going to be using it because we need to check inside the ear canal to see what's going on. Why is it that the patient is complaining about losing their hearing? What is it that is inside? So that's how it works. So that's basically how it is. So how the procedure is done. So pay attention because right here I highlighted all the potential possible questions that you are going to have on your exam. So remember, you're going to have different types of tests, A, B, C, D, E, F, something else. You don't know which test you're going to get. So I have to go over all the possible potential questions that you may get because you might have A and this type of test might have one question, the other one is going to have the other one, and so on and so forth. So for that reason, I like to go over these things in very detail so you don't miss those questions. So it says right here, when you're doing this particular procedure, remember, you're going to place the patient in a dorsal recumbent position. So it is a supine position, but then you're going to turn the patient lateral. So when you place the patient laterally, then the part of the ear that it is, the one that you're going to be doing the irrigation has to be on top, right? So you are kind of turning on the side. You can do it sitting down. You can do it laying down, a little with the head, a little elevated. So that is not a problem. You're going to find your own technique and something that makes the patient feel comfortable as well. So you need to learn this first. Other than that, remember, you're not going to be able to do the procedure. So when the patient to remove certain parts of the clothes, but not everything. This part right here, particularly the blouse, the shirt, the t-shirt, because we don't want them to get wet, even though if you are going to be using a shop pad, something to cover right there, so water does not drip down the patient's shoulder or neck. Still, it is a good idea to ask them to remove certain garment and give them a gown to make them a little more comfortable. Remember, you don't want to leave the office all wet, right? So again, this is kind of, you know, being very cautious about the patient. Then you're gonna kind of fill in the syringe. So the syringe actually is kind of 60 cc's, cubic centimeters is a large syringe. Can I use something like 5, 10, 15, 20? Because it's going to be small and you're going to be kind of filling in that syringe several times and going irrigate. No, we're going to have plenty of the irrigating solution inside that syringe that it holds at least 60 cc's volume, and that will be the best way. So we don't have to, once again, to be filling in the syringe and coming back to the patient's ear back and forth. So for that reason, we're going to use a syringe that is large enough. Now it says direct solution towards the roof of the canal. So you see, there is a canal right there within the ear, right? So the ear looks like a funnel. This is the ear, the air outside, and this is the ear canal. So when you direct the syringe, when you direct the flow of water on the syringe comes right here to the entrance, then you kind of direct it to the roof. You do not direct this all the way here. Why not? Because the cerumen is around here, somewhere around here. And if you direct this in the middle, you're gonna push all the cerumen to the end of the ear canal, very deep inside. So you're not doing anything. You are making things worse. Now, if there is not enough cerumen, this pressure that this water is gonna eject when you kind of, pump this water out, press this plunger, and the water is gonna kind of go fast. If it goes directly right here, it can break the tympanic membrane because it's a very, very tiny membrane that separates the external ear canal with the middle canal. So for that reason, you have to direct the water pressure towards the roof of the ear canal. So that is basically what it's telling. Makes sense if you understand, the dynamics or the analogy. Solution temperature needs to be in between 98.6 to 100 degree, meaning it has to be a little warm. Remember, if it is cold, it's not going to be good. And the patient is going to become dizzy a lot faster. So the solutions that you put inside the patient ear should be a little warm, not hot, warm, because then it's going to burn the patient's ear canal. You don't want that. So that's basically what it is. So whenever you are talking about ear irrigation or ear drops, all these needs to be warm up. They cannot go cold over there or less than 98.6, which is the body temperature. Has to be from body temperature a little higher, 100 Fahrenheit. Of course, you're not gonna go all the way, but you feel it that it is warm enough, but not that it's gonna burn the patient. Set right here. So this is 1, this is 2, this is 3. Never block the ear canal with the syringe. So if you remember, I mentioned that when you are going to apply right here, the syringe, see the syringe got right here at the enters of the ear canal. You do not put the syringe right here within the ear canal. That is not what you're gonna do. So this is where the ear canal begins. All this part right here, this funnel-like structure. So the syringe has to be right here, and the tip has an specula over there. So the tip is the one that actually enters right here, not the syringe. This flange right here is not gonna block the ear canal because the water is not gonna be able to retract, to withdraw when you're pressing pressure, because you need this wax, if it's there, to be wiped out, to be removed. But if you are blocking it completely right there, in the flange, this part that has an ear-like structure of the syringe cannot be blocking the entrance of the ear canal. So that's basically what it is. Because when you kind of direct the flush of water towards the roof of the ear, this water has to come out and it's going to drain whatever is there. If it is wax, it's going to take it down. And here you're going to have the basin that is going to collect all the water. But if you block it right here, how is the wax going to exit? And you're going to feel actually pressure inside your ear. So for that reason, the syringe does not go inside. It's the specular that goes inside, not the syringe, meaning do not block the entrance of the ear canal. So that's basically what I'm trying to tell you. Next, 4, tip of the head towards the affected side. So you're gonna tip the head towards the affected side. Why? Because you need the water to come out by gravity, right? So that's basically what it is. So you're gonna incline, you're gonna tip the head. Straighten the ear canal. This is a question for exam as well. Pay attention to this because there are 2 ways of doing ear irrigation for children and for adults. So you need to know how to manipulate the ear. See this flap structure that is called pinna? This is our article. These are supposed to be doing something. You can't just place the syringe right there. You don't even know where the ear canal goes, in which direction. So we need to maneuver the ear before actually are putting there the tip of the syringe inside the ear canal. Now pay attention to this, because if we are dealing with adults, see, we are going to pull the ear up and back. So you're gonna go like this, up and back. Why? Because you're gonna straighten the ear canal. Now I'm gonna have right here the tip of the tragus that you can see, and then the little hole that goes inside. If it is my ear like this, you're not gonna be able to see much the ear canal. So we are going to make sure that that ear canal is straightened. So you can actually put the tip of the syringe right there, and the water is gonna go inside without no trouble. Not that you're gonna flush the water inside and all this water comes out, because that wouldn't be a good idea, right? So think about this question for exam once again. If you are doing an irrigation on an adult, read the question, because it says right there, the medical assistant is being ordered to do an irrigation on an adult patient or someone who is 18 and up. So remember, if you are 18, 19, 20, 40, 50, 60, 100, you are an adult. Less than 18, you are a minor. So pay attention to these questions because sometimes you might know the answer. Don't rush yourself. Read the entire question because when you read the entire question, you're going to see exactly what is it that they are asking you. So when you see that this is an adult, because that's the first thing that you have to look for. Don't worry about the ear irrigation. Oh, you're going to do an ear irrigation. Fine. What is it? Now you have to be thinking, okay, am I going to do it on an adult or on a child? So those are the things that you have to be thinking immediately because that's the questions that you're going to be asked about it. So then this is an adult patient and you're doing an ear irrigation. So how you are going to go about to do the job, to do the procedure. You're going to remember, you're going to hold the ear on an adult up and back. Now, what about if it is a child? Be careful because it's not the same. Why? Because the ears of the child has not developed yet, so the ear canal is horizontal. And an adult is like this. It's oblique. So for that reason, we have to do up and back. For the children, you have to do pull the ear down and back. So that's basically what it is. Both of them, adults and children, you're going to pull it back. But then for adults, up, for children, down. So I give you a tip so you can remember if it is an adult, how you're going to pull the ear. Because you're going to have both answers right there for both of them. They ask you for an adult, they give you both answers. Of course, they're going to give you other answers that they're going to try to confuse you. But this is what you're going to remember. An adult, think about this. An adult has lots of years, right? More than a child. So it is up. For children, down. See? So for an adult, up, back. For children, down, down, back. That's it. So that is how I remember, because when you see the questions, you definitely gonna mix them up. Because I know it happens. It happens to me a lot when I was learning this. I always got confused. So I didn't know how to distinguish between them. Because when I have the answers, I have all these answers right there, then I get confused. Oh my God, is it up and down, up and back, up and to forward? I don't recall. So the answer is, remember, an adult has lots of years, so it's up. Many years, so the ear goes up and back. Don't worry about the back because for children and for adults, you do that back and up. So back, back for both of them, but for adults, up, for children's down. And that is it. And make sure that is back, not forward. We don't do that. So think about that, and you will see that you will get better on these questions. So any questions about how you are going to manipulate the ear from a patient, depending whether it's an adult or a child when you do it an ear irrigation? Because this is the key. If you don't do it that way, believe me, that water is not going to go inside the ear canal, so you're not going to get the job done. And the patient is going to have the same problem. So basically, that's how it is. Now, one more question right here. What is the most common condition that the patient develops, or what is the side effect, so to speak, of doing an ear irrigation? So patient might become dizzy during the procedure. Remember, you are pouring some type of liquids inside the ear. That makes the patient feels dizzy sometimes. And even worse, if the water is cold. If the water is not kept a little warm, then the patient is going to get dizzy no matter what. So be careful with this. So that's how it works. Remember, the procedure is not difficult. It's just that you have to follow all the guidelines. If you don't, then the procedure is not gonna do no effect for the purpose. So that's basically what it is. So you can see right here. Now, one more, remember the temperature of the solution has to be warm. They're not gonna ask you what level of degrees. It's just that it has to be warmer, not cold. So we don't do that. So that's basically what it is. Okay. So any questions? Here it is. So see, this medical assistant is pulling the ear up and back, and you see how it is positioned with the syringe to make sure, that just the tip of the syringe is the one that enters right here, the ear canal, not this flange. See, not this part right here that looks like, goes around. It's not right here blocking it. Because you have to give space for the water to come out. That's basically what it is. So that's the proper procedure. And if you see, the patient is holding the basin right here. See, the basin has this indentation that fits completely right behind underneath the ear. Then there is a blue shock right here. See, covering the patient, clothes, the shoulders, so we don't kind of messed up the patient's clothes. So that's basically what it is. Can you do a laying down? Yes. Now, I recommend it to do the lay down, particularly if you are short of stature, because if the patient sitting on an exam table and we are kind of short like me, and then the patient is kind of tall, then you're not going to be able to see what you're doing. It's going to be very awkward trying to kind of reach up there the ear. So you place the patient on one the sides. Depends what is the problem, what is the ear that the patient has the problem. So after you do this, now you're gonna do next, because you're gonna apply a little pressure right here to flush this water over towards the roof of the patient ear, and then the water is gonna come out. And later on, when you remove this, when you finish flushing the entire volume of irrigation solution into the patient ear, now you're gonna see it in the basin and see if there is any residuals of wax or anything else that have come out. Depends what is the purpose. So that is it. Now, if it is an object that is there, we're not gonna do irrigation. We do irrigation only to remove wax, not to remove objects or any other insect that might have, crawl inside the patient ear. So that has to be done by the medical doctor. So that is basically what it is. Now let's watch a little video that I have right here so you can have an idea of how this is done. So just for you to see it. Uh, uh, just give me a second. So I'm going to share this video with you. Okay, so let's watch this video doing the ear irrigation. Pay careful attention because that is from the company, the publisher of the book. So that's from the same book.
In this procedure, you'll learn how to remove excess or impacted earwax cerumen from one or both ears. The first step is to sanitize your hands. Next, check the provider's order and assemble your materials. To prevent a medication error, it's important to check the label of the solution 3 times. First, check the label when you remove the solution from the shelf. Check the label a second time as you pour the solution into the applicator. Check it a third time when you return the solution to the shelf. Prepare the solution as ordered. It should be kept at body temperature to help loosen the cerumen. Before you begin, introduce yourself to the patient. Be sure to use 2 identifiers.
Can I have your full name and date of birth, please?
Yes, it's Norman.
Then explain the procedure.
Mr. Lepo, so today we're going to be performing an ear irrigation. So what I'm going to do is I'm going to use this device and I'm going to squeeze a special solution into your ear, and that's going to flush out the earwax. Do you have any questions about the procedure?
Use an otoscope to check the affected ear and locate the cerumen impaction. Place the patient in a sitting position with his head tilted toward the affected ear. To keep his clothing dry and direct the flow of the solution, place a towel over a polylined barrier on the patient's shoulder. Place the collecting basin on the towel beneath the ear. The patient can help by holding the basin.
I'll be tilting your ear towards the base.
Wipe away any foreign particles to avoid introducing them into the ear canal. For the patient's comfort, ensure that the solution is warm. Medication that's cold may cause pain, nausea, or dizziness. Fill the syringe and expel any air from it. Trapped air increases the pressure of the irrigation and may cause discomfort. To help the solution circulate, straighten the outer ear canal. For adults and children over 3, gently pull the pinna up and back. For children under 3, pull the earlobe down and back. Place just the tip of the syringe into the opening of the ear. Gently direct the flow of solution toward the roof of the external auditory canal. This helps protect the tympanic membrane, remove embedded material, and keep the patient comfortable. Refill the syringe with warm solution and continue until the material has been removed. Note the particles in the collecting basin to be evaluated after the procedure. Dry the patient's outer ear. Then, dry only the visible portion of the ear canal with a cotton-tipped applicator. Don't insert it any farther. Doing so could cause serious trauma. Inspect the ear with an otoscope to determine the results. Allow the patient to rest quietly with his head turned to the irrigated side. Sanitize your hands. Document the procedure in the patient's health record. Include the date and time, the ear irrigated, the type and amount of solution used, the characteristics of the material expelled during the irrigation, the visibility of the tympanic membrane after irrigation, and the patient's reaction, if any. It's vital to record all of this information.
Okay, so it was kind of very straightforward video. Any questions about the video? So I'm going to clarify something that the medical assistant says about, whoever was the narrator of this video, about the age of the patients to manipulate the ear, whether up and back or down and back, right? So don't get confused. In the real world, yes, someone who is over, 5 years old, something like that, in the class, don't worry, you have, that's it. So it's not specifying how old is the child. So they're just gonna see the child. If it is a child, you go straight forward. That's it. You pull the ear or the pinna down and back for a child. Remember, for adults, up and back. All of them are back. It's just done for an adult, it's up. For the children, it's down. Remember, children has less years, down in age, down the year. For adults, up, more years, so put more, so pull it up. So that's basically what it is. Every single time that you do procedure, after the procedure, see, the patient is laying down on the side of the ear. Why? Because we want any residual of solution that have still remain inside the ear to get out, to come out. Otherwise, you're gonna develop the swimmer's ear. This is like when you get ear in water in your ears, and then you feel like you can't hear either. So for that reason, the patient has to be laying down on that particular affected ear for a little while, like 5 to 10 minutes. So all the water that was in the ear canal is going to be drained, and then you're not going to have problems. So that is basically what it is. Anything else? See, you notice they mention everything that I said. Of course, a little more, how you prepare, how you identify the patient. Remember, for every single procedure in your medical office, not when the patient are hospitalized, it's different way of identifying them, but in an outpatient setting, you're gonna identify the patient using 2 points identification. Remember, full name, and date of birth. Always, these are questions for exam. So I like to go over all these over and over and over. So if you hear them many times, when you see these questions, you immediately recognize. Remember, 2 points, 3 points identification means what questions you ask the patient. What is your name? Last name. This is one thing because it's a full name. And then date of birth. So there are 2 points identification for outpatients. If you are admitted in the hospital, you're not going to ask them, what is your name? Of course not. We're going to go over that later on. Because remember, these patients are sick, they are under medications, they are confused, they have a lot of issues. They don't even remember who their names are. So don't ask name, look the bracelet. That information it is because the patient is being hospitalized. All the information, you can find it in the bracelet of the patient. That is it. But when you go to the doctor as an outpatient, you don't get a bracelet. You're not going to stay there. So you're sound. So you can respond to questions. You're not in an emergency situation. So then we're going to ask your name. Can you state your name for me? Your last name, your date of birth. That's it. There is no social security, none of those things. It is just full name and date of birth. That is it. That's what we need. Okay. Any questions about this therapeutic procedure, irrigation? Okay. Moving on. Instilling ear medications. Now, patient comes and they said that they have pain in the ear. That's a different issue. Pain or I cannot hear, there are two different things. Now, the patient can come with both questions, with what complaints. Oh, I have pain in my ear and I cannot hear. Well, there are different things. The medical doctor is going to examine the patient. So that's basically what it is. After the medical doctor examines the patient, now it says, oh, you have an infection inside your ear. So you need some eardrops. That's basically what it is. Instilling ear medication means eardrops. That is it. You're going to need eardrops. So immediately they call the nurse or probably the medical assistant if that is the policy of your organization to allow you to do that if you've been trained to do so, of course. So that is very, very similar as when we did the irrigation. Just we are going to instill inside the ear canal drops, ear drops. So the first thing that the medical doctor is gonna do is gonna be looking at the patient ear to determine what is it, right? So the ear canal must be clear or unobstructed. Because if you have an obstruction, now we have to remove that. And then we're gonna instill the ears or put the drops inside the ear. Now, when you remove the medication, remember before was the irrigation solution or the irrigating solution. Now you have to check it out because these are particular, kind of medications that you're gonna be using, and you need to know that it's not expired. That's basically, and that you're getting the solution that is intended for the purpose of doing the procedure. So the medication that you're gonna remove from the cabinets, whatever the medication is out, because the patient don't bring it with them, it is provided directly in the medical office for the patient. So the label, you have to read the label that these are ear drops, not eye drops or something else. Remember, the label of the, the container is the one that is going to tell us what is it inside that container, that little bottle. So that's basically what it is. So it has to say there that it is for optic purposes, because optic, remember, ear. That is basically what it is. Now, we are going to place the patient comfortably in a table, whether sitting or laying on the side, remember, with the affected ear on, on the upper part so we can see it. But the patient is going to be kind of inclined a little bit, the neck. So it's going to be kind of moving the neck a little bit so the medication do not fall. Because in this case, we don't want to flush the eardrops out. We need to place it in, and they're supposed to stay in. So that's basically what it is. It says right there, never let the dropper touch the ear canal. So you have to kind of remember, do the same thing that you did when you were going to do the ear irrigation. Pull the ear, if it is an adult, up and back so you can expose the ear canal, and then from a little distance from the ear canal, you are going to kind of squeeze the dropper. You do not place the dropper inside the ear canal, should not be touching it, because the patient has an infection or probably has an infection. And these droppers are multi-use. This is not one-time use. We have to use it again for other patients. So if we touch the affected area and the patient has an infection, now that dropper is already contaminated, and probably something is inside the eardrop bottle. So we don't need to contaminate that. So that's basically what it is. After now, remember, we still have not done the procedure. We're gonna do something else because remember, we need to keep these medications also warm, but that's in the next slide. So rest with an affected side down for 5 minutes. Insert moist cotton ball or gauze square into ear canal opening if ordered. Now that is to prevent the medications to leave the ear canal. But remember, when the patient lays down, he's gonna lay down in this position so the drops do not, drain out. So that's basically what it is. So we're gonna see it right here. See how it is? So you're gonna pull up and back because you're gonna expose the ear canal. So now this dropper should not be touching any part of the ear canal structure. Should be like kind of close, but not touching it. Then you squeeze the little bottle for the number of drops that the medical doctor has ordered to instill on the patient's ear. So that's basically how it works. And then you're gonna put a little gauze or cotton ball right here at the entrance of the ear canal so the medication do not come out. But you're gonna be keeping your head tilt to the other side so the medication doesn't come out. So that's basically it. Here is another position, even more comfortable for the patient, for the person who's doing the procedure. Because remember, sometimes it's a little hard, when you have someone sitting and that person is very tall and we are not. So for that reason, taking in consideration these details, you're gonna be able to do it better. And the purpose is to instill these drops inside the canal and stay there. Not just to put something in there and then you put the gauze right there and all the drops, all the medication just get into that cotton ball or gauze because it didn't go directly to the canal. See, it's a lot easier to do it this way. I mean, I have done this so many times that this is the position that I prefer, or laying down. So once again, that is how it's done. Now, I don't see here something. This medication, you have to eye irrigation. No, it's missing something because before you kind of put the drops inside the ear, you have to kind of go like this. You're gonna warm up the medication on the, inside the palm of your hands. So that's basically what, remember, this medication needs to be warm. I don't know where is that information. I have it, but that's how it is. So the little bottle, you're gonna place it in between the palm of your hands and you're gonna do like this. You're not gonna shake it. You're not gonna do anything else. It's just put it in between the palm of your hands and you are gonna kind of get a little warmer. Because if you place this medication cold, the patient is going to become dizzy. Remember, that is one of the side effects of medications or any procedure that you place inside the patient ears that is cold, has to be warm. So that's basically what it is. I don't know what is that information, but it was there before. So remember the water, the instillating solution that you're gonna use to kind of flush the ear or irrigate the ear has to be warm. The drops needs to be warm. And how you gonna warm it up? Just kind of rubbing them in between the palms of your hand. So that's basically what it is. So here is a video how to do that. So we're gonna watch it and you're gonna have a little or better idea how to do the procedure. So that's basically how is done. Paste. Okay. So just hang in there. I'm gonna. Okay. I'm playing the video now.
In this procedure, you will learn how to instill an accurate dose of the correct medication directly into the external auditory canal. Check the provider's order. Sanitize your hands. Then, gather your equipment and supplies. Check the expiration date of the solution. Follow medication safety procedures and check the label of the solution 3 times. First, when you remove it from the shelf. Second, before you administer the medication to the patient. Introduce yourself and confirm the patient's identity using her name and date of birth.
Hi, Kiki. I'm Julie, medical assistant. Good. I just need to verify a couple of things. Could I get your full name and date of birth?
Kiki Moore, November 24th.
Explain the procedure to help put the patient at ease.
So Dr. Anderson has ordered some medicated eardrops for you today. And when I put those in, it might tickle a little bit, but it shouldn't hurt. Have you ever had eardrops before?
No, not at all.
Okay, great.
Place a disposable polyline drape on the patient's shoulder. Sanitize your hands. Put on a pair of disposable gloves. Check the temperature of the medication bottle. If it feels cold, gently roll the bottle back and forth between your hands to warm the drops. Have the patient sit up and tilt her head away from the affected ear, or lie down on the side with the affected ear upward. Hold the dropper firmly in your dominant hand. Place the tip of the dropper in the ear canal meatus and instill the number of ordered medication drops along the side of the canal. Make sure that the tip of the dropper does not touch the ear canal. To help the medication reach the base of the canal and prevent it from immediately running out of the ear, instruct the patient to rest on the side opposite the affected ear and to remain in this position for approximately 3 minutes after the medication has been administered.
And now I'm going to have you lay back for me, and I want you to lay on your left side. So I'm going to have you lay on your side for about 3 minutes so that medicine can get in where it needs to be to do the job it needs to do. Okay? I'm also going to place a cotton ball in your ear just to help with that too.
Okay.
Okay.
If instructed by the provider, place a moistened cotton ball into the ear canal to protect the ear canal and prevent medication from leaking out of the ear. Remove your gloves and dispose of them, along with the cotton balls and drape in the biohazard waste container. Put on a new pair of gloves and disinfect your work area. Then sanitize your hands. Document using the appropriate abbreviations. Include the date and time, name, dose, and strength of the medication, the ear treated, and any reactions the patient had.
Okay. Any questions about putting the eardrops on a patient or instilling medications on the patient's ear?
Do you do only one ear, like just only the infected ear? You don't have to do the other ear?
Correct. Only what the ear that the patient is complaining about it. The same as the irrigation. We evaluate both ears with the otoscope, but then if the damage is in one ear, you're just gonna do that. If the patient complains about both ears having a problem, the medical doctor is gonna direct us to instill the drops in both ears. So that's basically what it is. Most of the time, it's just one ear. Most of the infection starts in one ear, and then, depends on what type of infection it is, might move to the other ear. So that's how it works. Any other questions? Interesting, isn't it? So you see all the procedure done completely. Remember, we covered this before. We're gonna wear gloves, wash our hands, wear gloves, remove those gloves, wash your hands again, because we are going to keep this time all, standard precautions every single time that we're going to do a procedure or we're going to handle something that we might get contaminated. So that is basically what it is. We're always going to identify the patient. Remember, we need to identify the patient. We must make sure that, we are providing the services of the procedure to the appropriate person, that we're not, confusing or doing someone else something, a procedure to someone else. So that's the reason why we have to go through all these steps every single time that we have a patient. Remember, those medications needs to be evaluated 3 times. Next module is going to be pharmacology. We're going to go over those again. But you see, you've seen it from now. So every single time that you see things, then later on, we're going to see it in another chapter, in another chapter. So that is going to help us. So that is very, very important that we understand. And every single time that I present you with a video, then it's going to go over every single step, explain the procedure. Don't assume that the patient knows. Yeah, I have this problem with my ear. Even though if you tell me, you ask me, oh, I have this before, still, you have that before, but you probably don't remember now. You know that you were there, but you still need to go over the procedure, the steps, what is it do? And you're always going to say, the doctor ordered this. I'm going to perform this procedure on you. The doctor ordered it. The doctor ordered it. You have to say that all the time if you're not the doctor. Why? Because if you don't, the patient might kind of, refuse to do it. So you don't want to go through all this process of calling the doctor, explaining the doctor that this patient doesn't want to do the procedure, because at the end of the day, the medical doctor is going to come over, is going to talk to the patient, and the patient is going to do it. So you're going to be wasting a lot of time. So explain them. Make sure that you do all the steps so you don't miss anything. So if anything happens, you cover. That's basically what it is. Let's move now and do an eye irrigation. So this is not an ear irrigation. Now it is an eye irrigation. So that's basically what it is. So before we move to this, if you remember when you were watching the video for the instilling medications on the patient ear, you noticed that medical assistant was kind of, rubbing or frictioning the little bottle in between the palms of the hands because the medication has to be warm. So that's basically what it is. That's something that I was in my PowerPoint presentation. I don't know, maybe I was doing something and I deleted somehow, but it was there before. I don't know. So that's basically what it is. I just want to clarify that because that's going to be a question for the exam. Irrigation. Here we're going to have other questions that they're going to come out on your national exam. Because remember, these procedures, once again, even though if you don't have to do it, you need to know because you're going to assist the medical doctor and they're going to ask you questions about it. Now, what is the purpose of doing an eye irrigation? It might be because something got into your eye, an irritant. Your eye is itching. Somehow something is bothering you, so you have to get an eye irrigation. You have an infection. You have discharge, the eyelashes sometimes got kind of, stuck in the morning and you can open it up. You have to go wash your face, and then you can see some yellow greenish discharge surrounding your eyelashes and, the eyelids. So for that reason, you need to be having this eye irrigation. Or something fell off in your eye. You were dusting something, a little something fell, flew right into your eye, or you were working on something, you were not wearing glasses, protective glasses or goggles, something got into your eye. Now it is time for you to get this eye irrigation to remove the particle or soothe the eye, external part of the eye. So that's basically what it is. One of the things that I like to explain to you guys that every time that you have something in your eye, that you feel that something is there, do not rub your eye, because that's the first thing that we kind of, wanted to do. Oh, my eye itches, so then, oh, something is in there, and then we start rubbing your eye. Well, that's a big mistake, because you don't know exactly what went into your eye. And if it was something that is solid or something else, you might kind of scratch your cornea, that little transparent, kind of shiny structure that covers the eye on the front. So be careful with that, because that's the reason that after you rub your eye several times, now your eye burns more, because now you're damaging it. So what you have to do is something falls into your eye, anything, go and watch your eyes. Kind of open your eyes and pour a lot of water right in there. That is if you are at home. But if you are at work, you're not gonna do that. So we're gonna do it a little differently. So that's basically what it is. For this reason, we are going to use this sterile solution or sterile liquids that we're going to have in our office. Why? Because the part of the eye is very sensitive. So you don't want to place tap water in there. If you are at home, yes, you can do anything, because if you have something falling off onto your eye, then you have to try to remove it instead of rubbing it, because it's going to be worse. So we're going to use sterile water for these purposes. Now, once again, we're going to use syringe, but we are not going to contaminate the tip of the syringe. Remember, we are not going to touch any parts of the eye with the tip of the syringe. That wouldn't be a good idea either, because the eyes are very sensitive. Not only because it's going to get contaminated, because you probably have an infection, who knows, but the eye cannot be touched with any instrument or anything else, because it is very sensitive. Once again, we're going to position the patient, remember, comfortably, so we can do the procedure appropriately. So that's basically what it is. So here it is. So if you've seen some of the pictures, some of the images here, they have the patient laying down. I prefer that position for a lot of things. When I'm drawing blood, I like to place the patients laying down, just in case they faint. If I'm doing an ear irrigation, laying down, it's a lot more comfortable for me as the provider and for my patient. You don't want a patient to be tilting the neck right there. It's very uncomfortable. And you're going to be able to do things a lot easier. So that is the way that I do it. And I recommend it to adopt the technique that mostly suit you, because remember, you are the one who's going to be doing it. So this is how the patient is placed. Remember, the eye that is going to be irrigated is going to be on the side of the medical assistant or the provider. So that's basically what it is. The head is going to be tilted a little bit. Now here we have a basin as well. But this basin is a little different from the one that we use for the irrigation. This only has an indentation in one of the sides, like the contours of your face. So you can place it right there, and the water can just slide down and fall into this particular container. So that's basically how it works. So let's see it. Oh, wait a minute. So we're just gonna start now. It doesn't say much. I don't know what's going on with the slides. So when you use the syringe, once again, we're just gonna place the syringe tip right in this area at the canthus close to the nose. This is the canthus where the eye cornered close to the noses are. So we're gonna try to flush from here, and the water is going to drip all the way, watching the eye completely. So that's basically what it is. So here, this person is just wiping it off from the outside after the irrigation has been done, has been completed. So that's basically what it is. So it's very simple, but once again, you need to know how it works. So let's watch another short video, and you're gonna see how to do the irrigation. Any questions about the irrigation? For the eye irrigation, they don't have questions on the exam. Most of the time is ear, and for the eye, remember ear irrigation and ear installation. So that's basically what it is. Now, remember, for the irrigating of the patient ear, just cleaning it out, washing it off, not questions. Now that we're gonna place medications on the eye, that's a different issue you need to know. So for now, let's watch the short video right here. How to do the eye irrigation, and then we move on to the next procedure, which is instilling medications on the patient eye, or just placing eye drops. So that's how it works. Hmm. Okay, just watch the video and I drop you.
Irrigate one or both eyes, as ordered by the provider. Before you begin, sanitize your hands. Then, assemble your supplies. Check the expiration date of the solution. Follow medication safety procedures and check the label of the solution 3 times. First, when you remove it from the shelf. Second, after assembling your supplies. And third, right before the medication is administered to the patient. Introduce yourself and confirm the patient's identity by name and date of birth.
Morning, Kiki. How are you?
Fine, and you?
Good, good. Could I get your full name and your date of birth?
Key Moore, 1124. And
Provide the correct education to the desired effect and common side effects.
Dr. Anderson would like to have you have an eye irrigation done today.
what's that?
Answer any questions the patient may have. Use language the patient can understand. Ask the patient if she has any allergies.
That we're just going to use some solution and rinse out your eye just to help it feel a little bit better.
Okay.
All right. And so before we get started with that, I need to have you lay back for me.
Assist the patient into a sitting or supine position, making sure that the head is turned toward the side of the affected eye. This position allows solution to flow away from the unaffected eye, reducing the chance of cross-contamination of the healthy eye. Put on gloves. Place a disposable drape over the patient's neck and shoulder. Place, or have the patient hold, a drainage basin next to the affected eye to receive the solution from the eye. Make sure to place a polyline drape under the basin to prevent the solution from getting on the patient. Moisten a gauze square with solution and cleanse the eyelid and lashes of debris. Start at the inner canthus near the nose and move to the outer canthus farthest from the nose. If you are using a bulb syringe, pour the required volume of room temperature irrigating solution into the sterile basin and draw the solution into the syringe. If any prepackaged dispenser is used, remove the lid. The solution should be room temperature so that it does not irritate the patient's eyes. Separate and hold the patient's eyelids with the index finger and thumb of one hand. With the other hand, place the syringe or dispenser on the bridge of the nose parallel to the eye to steady it. Squeeze the bulb, directing the solution toward the lower conjunctiva of the inner canthus. Allow the solution to flow steadily and slowly from the inner to the outer canthus. Do not touch the eye or eyelids with the applicator. Refill the syringe or continue to gently squeeze the prepackaged bottle. Continue the procedure until the amount of solution ordered by the provider has been administered, or until drainage from the eye is clear. Dry the eyelid with sterile gauze, moving from the inner canthus to the outer canthus. Do not use cotton balls because fibers might remain in the eye.
So are you feeling all right?
Feeling fine.
Okay, good. Then I think we're done for today. As long as you're feeling all right, you're free to go.
Okay, thank you.
Thank you. Have a nice day. There we go.
Dispose of the irrigation drainage. Remove your gloves and dispose of them, along with the drape and gauze in the biohazard waste container. Disinfect the work area after putting on a new pair of gloves. Sanitize your hands. Document the procedure in the patient's electronic health record. Include the date and time, the type and amount of solution used, which eye was irrigated, any significant reactions by the patient, and the results.
Okay, so that was another illustrative video. Because sometimes, it's a lot easier when you see it. If you see the procedure being done, then you kind of get a better, picture or understanding of what is it that, you need to be doing. So that's basically how it works. Okay, moving on. Any questions about ear or eye irrigation?
Have question? If the
Any
patient is
question? Go ahead.
yeah, if the patient is wearing makeup, so how do we handle the makeup?
Okay, remember that it is the eye. Probably, well, if the patient is wearing makeup, remember that's what the first thing that they do is you clean this area, the eyelashes and the surrounding part of the area. But we're not actually removing the makeup. We might kind of, when do this cleaning, but we don't worry about that. Now, if you have fake eyelashes, I assume that you might have to remove them. So that is a different issue. Follow the policies of your organization, but most of the time, because of the trend of these eyelashes now, probably you might have to remove them because it's going to be a little difficult trying to irrigate your eye with those eyelashes that are a little longer than the natural ones. And probably they are the cause of the infection. So good question. We do not remove them. I assuming that that's the makeup that you put right here in between your eyebrows and your eyelashes, that part where you see there in the video, in the picture being clean. So like here, this area right here, if they have makeup, well, we're not worried much about the makeup. We just worry about passing a wet little cotton ball or a gauze to remove any debris, any particles that might be there by the eyelashes. Once again, if it is fake eyelashes, you might have to remove them because might be the problem, might be the ones that is causing, or as you pass in the cotton ball or the gauze, you might detach them. I don't know how that works, to be honest with you, with the eyelashes. They are going to be easy to be removed when you make pressure or not. But other than that, you just gonna clean that part of the the eyelashes. What mostly we're doing is removing anything, any little particles that might be close to the eye. And remember, these eyelashes protects the eyeball and the eyelids. So for that reason, you might have some debris in there if that is the reason that you're there. But just to make sure, we don't worry about the makeup. And if part of the makeup comes out when we cleaning with this cotton ball or with this moist cotton ball or with the gauze, that's not a big issue. It's, you want the problem to be solved. So that is basically what it is. I hope that answered your question, because don't worry much about, the makeup, because the makeup might not be the problem, or maybe it is. So then we're going to find out what is it, because most of the time, if you do an eye irrigation, it's because something is in there. Something, the patient complained about something falling onto the patient's eye. So that's basically what it is. So that nobody, however, asked me that question, but I believe that is basically what would you do. That's what I would do, right? So any other questions? So in general, do not worry about, the makeup. I will be more worried about the eyelashes if you have the fake eyelashes, because, they are kind of long, overlapping the opening of the eye. So when I'm going to try to open the eye to do the irrigation, that's going to be a problem. That's going to be a little hassle right there trying to get through those eyelashes and probably, not do the procedure correctly. I will try to update myself
Thank you.
now with this makeup and eyelashes. You're welcome. Okay, any other questions, or anybody else have any better answer than me? Maybe you went to the medical doctor and they did something in your eye and you went through kind of this situation, but I don't think that is a big deal, the makeup. Just, we just want to kind of moist a little bit the part of the eye from the outside to remove any debris, any little particles, so they don't fall into your eye and then becomes worse, the condition that we're trying to fix. So that's basically what it is. Anyone else? Okay. Now let's talk about eye drops. Remember, instilling eye medications. First, we clean the ear, then we instill drops into the ear, right? Then we clean the eye. Now we're going to instill drops onto the eye. So there are certain things that you need to keep in mind, particularly for test purposes. Because believe me, whenever we do these eye drops, 99%, if we do it wrong. And I'm going to tell you why. Because whenever you're going to do this, the first thing that you do is you're going to ask the patient to open their eyes, or you open their patient eyes. And yourself, I'm talking about at home, when you don't know how to do the proper procedure, this is what we do. And I'm seeing it in many times. You open your eyes, or you open your eye with your two fingers, and then you put the drop right on top of the middle of your eye, on the eyeball, so to speak. That's what we do. And if some of you have used eye drops, that is exactly how you do it. If you have not taken these courses, you don't know how to do it, and but that's wrong. That's not how it's done. The eye drops are supposed to be placed on the lower conjunctiva. So the conjunctiva is these eyelids, remember? The eyelids, that the upper and the lower, the one that holds the eyelashes. So you're gonna pull down this eyelid, and then you're gonna ask the patient to look up, and then you're gonna place the drops right there on this particular part of the conjunctiva, this little canthus, this little group that separates the eyeball from the eyelid, the lower eyelid. So that is basically how it's done. And then you're gonna ask the patient, or you're gonna roll your eye up and down, to the right, to the left. And then you're gonna disperse all or spread all the medication on the entire eyeball. That's how it's done. Other than that, you probably gonna drop and you're gonna miss the medication. You're gonna place the drop somewhere else, or the drops are gonna fall off. So that's basically how it's done. So what exactly that we place on the patient eyes? Liquid or ointment? Remember, liquid is just very watery, right? Ointment is like very little creamy. So that's basically what it is. So regardless of what it is, it's got to be done that way. So if we do it, this procedure with the dropper, once again, the dropper should not be touching the patient's eyelids or any part of the eyes. It has to be a little elevated without touching. We're just gonna go a certain distance from the conjunctiva, and we're gonna place the drops. Once again, we're gonna pull the lower eyelid down, and we are going to place the drops there. So remember, these are medications. Anything that you put there, it is a medication, because it is something that you probably have, and we need something that is going to fix that part of the external eye. All eye medications or all eye medication is sterile. So medications are sterile. That's basically what it is. Whether you place it in the patient's ears, eyes, or you have to drink it, you have to take it, you have to be injected, it is sterile. Meaning that it contains no chances of microorganisms. So here it is. See, I have it right here, but I don't have it on the eye installation, on the ear installation once again. Warm medication by rolling the medication, the little bottle, between your hands, because these are questions for exam. So think about this. Anytime that you're going to put ear drops, you're going to roll it. If you're going to put eye drops, you're going to roll it in between your hands to warm it up. So you're going to ask the patient to look up. Remember, that's what we're going to do, because we don't want these drops to fall off. So the patient is going to kind of lean the head backwards slightly, and then we're going to kind of pull the lower eyelid down, and then we're going to place the drops right there on the patient's conjunctiva. See? Place the medication onto lower conjunctival sac. So that is basically what it is. We're going to see a video, we're going to watch a video, and then you're going to see exactly what it is. And you're going to understand better how the procedure is done. If you don't do it this way, you're going to waste the medication. Now you're going to ask the patient once again to rotate. You don't say rotate the eye. That's how we talk, medically speaking. You're going to set them to roll their eye up, down, to the right, to the left, so the medication kind of spread around the eyeball. That's basically how it is. Very simple. All these procedures are simple because remember, medical assistant can do it. If you've been trained correctly to do this procedure, that is something that you can do. There is no problem doing these procedures. Here it is. Now you see the dropper is about this distance from this part, because this is where you are going to place the drops, not on the eyeball, remember. And you're going to pull down and up the eyelids, the upper eyelids up and the lower eyelids down. So we can expose right here this kind of little group in between the lower eyelid and the eye. And that's when the drops are going to go. So that's basically how it works. Remember, that's going to be questions for your exam. That's what they are highlighted. So you know, when you see this question, it's straightforward. That is it. The conjunctiva, not the eyeball, not the inner canthus, the lower canthus, nothing. It is right there on the lower eyelid. So that's basically how this works. Once again, we're gonna watch small short video on how to do the procedure, and then you can understand a lot better how it's done.
Say goodbye to Slack because chat's here and it's inside ClickUp. Everything you need in chat is here.
Oh, come on.
In this procedure, you will learn how to apply medication to one or both eyes, as ordered by the provider. Check the provider's order to determine which eye requires medication, as well as the name and strength of the medication to be used. Before you begin, sanitize your hands. Then, assemble your supplies. Check the expiration date of the solution. Follow medication safety procedures and check the label of the solution 3 times. First, when you remove it from the shelf. Second, when you assemble your supplies. And third, before administering the medication to the patient. Introduce yourself and confirm the patient's identity using her name and date of birth.
I just need to check a couple of things with you. Could I get your full name and your date of birth?
Kiki Moore, November 24th, 19.
Explain the procedure to help put the patient at ease.
So Dr. Anderson would like me to administer a dose of Neosporin, and that's going to be some drops that are going to go in your eye.
Okay.
All right, so it shouldn't hurt, but it might feel a little uncomfortable for just a little bit.
Okay.
All right.
Sanitize your hands. Before administering the medication, put on a pair of disposable gloves. Assist the patient into a sitting or supine position.
I'll be using a gauze square just to pull down on your lower eyelid, and that's going to create a nice little pocket for me to put those eye drops in. Okay. And I'm going to have you tilt your head back a little bit. Thank you.
Ask the patient to tilt her head back and look up to help prevent the applicator's tip from touching her cornea during installation. For eye drops, remove the cap. With your non-dominant hand, hold a piece of sterile gauze. Pull the lower conjunctival sac downward to create a pocket for the medication. Administer the prescribed number of drops or amount of ointment into the eye. For eye drops, place the drops in the center of the lower conjunctival sac, with the tip of the dropper held parallel to the eye and 1/2 inch above the eye sac. For eye ointment, squeeze a thin ribbon along the lower conjunctival sac from the inner canthus to the outer canthus, making sure not to touch the eye with the applicator. Have the patient close the eye and rub the eyelid in a circular motion. Wipe up any extra ointment. Dry any excess drainage. Explain that the medication may temporarily blur vision.
And you're feeling all right?
I'm feeling fine.
Okay, I just want to warn you that your vision may be a little blurry for a little while after this.
Okay.
That should take care of that for today.
Okay, thank you.
Thank you. Have a great day.
Discard the unused medication. Remove your gloves along with the gauze and dispose of them in the biohazard waste container. Put on a new pair of gloves and disinfect the procedure area. Sanitize your hands. Document the procedure in the patient's health record, including date and time, name and strength of the medication, dose administered, eye treated, teaching instructions given if treatment is to continue at home, and any observations.
Okay. Any questions about the procedures, instilling medications in the patient eye?
So just like the as in the ear, you only do one eye, right?
Once again, only the eye that is affected. If the
Okay.
patient is complaining about the left eye, we're going to work only on the left eye. If it is the left ear, the left ear. They complain about both eyes, then we install the medications in both ears, or we do the irrigation, both ears, both eyes. Okay? So we only do once when the problem is only one eye. But if it was both, we need to do the irrigation and the installation in both ears or eyes. Okay?
Okay, thank you.
Yeah, you're welcome. Sometimes this is the issue that we heard, right? We heard a lot of things. Well, if you have an infection in one eye, then it's going to move to the other one. True. But this is the thing. It's not that the infection goes to the other eye without moving them. We do. Remember what I said at the beginning? Do not rub your eyes or your ears with Q-tips and things like that, and then use the same Q-tip and put it on the other ear, or put your hand and rub the left eye and then the right eye. Here we go. You got infected your other eye. That is how it happens. That is how we spread infection from one eye to the other, from one ear to the other, because we use our hand to rub one eye, to touch the eye, and then we touch the other one without washing our hands before we rub or touch our other eye. So it's very simple. That's how we do it. So probably that's why, you were concerned. Okay, I heard that if I have it in one eye, it might move to the next. Why don't we do both? No, because the problem is one eye still has not moved to the other one. Remember, medications are for trying to solve problems, but when they are not used correctly, they can cause problems. If you take medication just in case, oh, well, I'm going to take this medication just in case I get this, well, you are putting yourself in trouble because you are getting all these chemicals that are foreign bodies. You're entering them without the need. So now you're going to create some issues for yourself. So again, we will discuss that during pharmacology. But it's a good question, and we need to understand why it's done in one eye, not both. Remember, think about patients complain. Patients chief complaint. I have problems with the right eye. That's the one that we're going to work on. I have problems with my left ear. That's the one that we're going to work on. My right foot hurts. That's the one that I'm going to evaluate. But if you say both feet, then we're going to go through those. Okay? So just make sure, remember, if you have questions, ask, because when you answering the questions on an exam or the patient comes in, you might have these questions from your patient. Oh, you only going to put the drops in one eye or one ear, or you're going to just, irrigate one eye, and what about the other one? So now you have answers, because you have only an issue with this eye in the doctor order. Remember the videos? you always gonna say that the doctor ordered it. The patient tends more to comply when you tell them that the doctor has given an order because they already saw the doctor. And the doctor told them, you're going to go to the lab, to the exam room, or someone else is going to come and do a procedure on you. They already know. But sometimes this is just playing around. They don't want to do it probably. They're on a rush. They want to go home or do something else, and they want to postpone this. So they give you the runaround. But actually, they know already that the doctor had ordered this procedure. So believe me, you just reassuring them. And that's exactly how it is. And there are questions in your exam that you have to tell them that the doctor ordered this procedure. For phlebotomy, they have that. But if you see it in every single procedure, you see the same routine, the same steps, the same protocols being followed, regardless what procedure the patient is receiving. But you have to put yourself in the same situation. That's why you're going to get kind of very mechanical, because this is what you do all the time. It's just like taking the train or the bus or driving from home to your workplace and from your workplace home. It's the same routine all the time. So you're going to be doing it the same way all the time because that's the right way to do it. Don't skip any of these steps because then you're going to create a little gap, a little loophole, and now complications can happen. So just do the simple things the way that you're supposed to be doing it. Regardless, I get very mechanical. It's like automatically. I know when my patient comes in, I greet them and I tell them this and I ask these questions and blah, 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 and follow through, depends what's the problem. When I finish immediately, okay, you're gonna go to the exam room. One of my assistants is gonna be doing a procedure. So I take you there or stay here. Someone is gonna call the nurse, the medical assistant to do the procedure. See you in 2 weeks. See you next time. Let me know how you're doing. If something happens, any questions. Have a great day. That's it. Because you get into this, situation in which, it's a routine. And make it a routine because that's exactly what you're going to be doing all the time. Get used to greet your patients when they come in and when they leave. Show concern for them because that's exactly what makes them feel good. If somebody ignores me at work, in the hospital when I go there, I'm going to feel very frustrated. I see that, I'm standing right in front of the counter. You don't even say, hello, can I help you? Nothing. You don't even ask me anything. And I'm telling you, I'm asking you, hi, how you doing? Hi, I'm here to see a doctor. And you ignore me because you're doing something else. That is very unprofessional. So you should stop whatever you're doing. Excuse yourself, whatever you're doing, address me, and then go back to whatever you're doing if you are busy with another client. But if you're doing your own personal issues, that's not an excuse at all. Remember, when you go to any place and they don't take care of you immediately as you arrive, you're not going to like it. So what makes you think that the patient is going to be happy? Ignoring them, not explaining them the steps, what to do, what not to do, what to follow. This has got to be all the time the same thing. I'm telling you, as a medical assistant, I never have any issues with this. I always was upfront on everything, making sure that the patient get all the information. Independently, the patient is being here many times and I have to draw their blood. I'm still gonna tell them, hi, how you doing, Mr. and Mrs. Smith? Here again, see, the doctor ordered another blood collection. So I'm gonna be drawing your blood, okay? Sure, not a problem. So don't assume that because they come to your room or you've been sent to this particular exam room, the patient already knows everything, they know you, and everything is fine. No, people are apprehensive. They probably never have these eye drops, they never have an irrigation or an ear. Explain them what's gonna be. Other than that, they're gonna be kind of scared. And sometimes they're not gonna cooperate with you because they don't know what's gonna happen because you didn't explain them. So don't assume that the doctor have done everything. You know, the patients are so apprehensive that when they are with the doctor and the doctor is explaining, then they're not paying attention. And then when you come to you, they said, oh, the doctor said that I'm gonna do something. What is it? But you go ahead and you go and explain them before actually they ask you. And be nice, and you will see that you will create good rapport with the patients, good relation, and you will do your things, and you will move to the next one instead of wasting time, trying to convince someone that this procedure has to be done. So you start by explaining them. Okay. Let's talk about the use of bandages. See, we use bandages for a lot of things. Now, is it that you have to do this once again? Probably, probably not. Most of the time, if you work for an orthopedic doctor, you have to learn this. They're going to train you because that's all they do. As medical assistants, you do the preliminary, the basic procedures. And actually doing these bandages, it's not a big deal. It's not difficult. And you're not going to harm the patient by just placing a dressing on the patients. So think about this. If you don't have to do it, fine, but you will have it on your exam. So at least you're gonna learn it for that reason. But if you have to do it to yourself, to your family, you have to place a bandage, at least you have an idea how to do it. You don't have to be perfect, but at least you have an idea what to do. I've done this many times, and sometimes I've used it in family, friends, away from the hospital when I was there, because I already know it. Other than that, it's say, no, take him to an urgent care, go to the medical doctor. No, you can start from home before you bring them to the medical doctor because you have to bring them anyways. Why? Because we use these bandages for different reasons, support or immobilization. This is one of the most common ones. You kind of twist your ankle or something, or your wrist. Place bandage right there. You're gonna immobilize that articulation because what causes pain, what can make things worse is movement. You see what happens when you twist an ankle? I mean, if you ever have this, I've never had this situation, but I have many patients that I have to treat for that. Well, the first thing is you cannot walk. You're gonna kind of limp. You're gonna start kind of, limping, kind of jumping, one and on foot, or using a cane or something else, because it's very, very hard, because it hurts if you place your foot on the ground, because you kind of injure some ligaments and muscle right there, and that hurts. And the more movement that you have, the more it hurts, and probably more complications. So we're going to mobilize and support that injured structure. So that's one of the main things that we can do. Also, dressings can be used, or bandages can be used to secure a dressing. See, you have a wound, and now you're going to put a dressing, but you don't want the dressing to fall off. Or you don't just want to place tape surrounding the dressing. You want to protect even more that area from contamination. So therefore, you're going to roll a bandage around that particular injury or cut or whatever else you have there. To apply pressure, you are bleeding. So one of the main ways to stop bleeding is applying direct pressure. Think about this. If you have gone to the medical doctor and they have drawn your blood, when they remove the needle, what is it that they do next? As soon as they remove the needle, they place a little gauze right there in the side when they remove the needle, and they apply pressure, mean they kind of squeeze over that area. They apply pressure. Why? Because we're going to make sure that the blood does not come out through that little hole that the needle left as it was withdrawn. And it's just a very tiny little opening. Leave it open, don't apply pressure, and you will see the blood sweeping out. Well, we're going to apply pressure. But let's say that someone had a cut, had an injury. Well, there's a lot of blood coming out. Well, what are we going to do? What we go to the doctor, and someone's going to put their hands right there and hold the hands all the way until you get to wherever you go? I don't think so. So we place a bandage and we roll up that area, and that is like applying pressure. So that's basically what it is. So there are different situations in which, you might need to use bandages. They are very important, very used techniques in the medical and non-medical. Remember, if it's something happens at home, at the park, somewhere else outside of a medical facility, well, if we have the knowledge, we can apply some first aid. And knowing how to utilize these bandages is a plus, because you know exactly what to do. This is like, knowing how to give CPR, cardiopulmonary resuscitation. Oh, but I'm not working in the medical field. It doesn't matter. A member of your family, a friend, someone randomly on the streets, visiting some friends, someone else collapses, at least you know what to do. What are the steps that you should follow? And you can save someone else's life. So that's basically it. Here you can save someone from pain, from that part of the body complicating more. Because remember, if you kind of, twist your ankle or your wrist or something else or your shoulder, and it's very painful, and if you try to move, it makes the situation worse, and you know how to apply these bandages, hey, that's going to eliminate a lot of complications until you reach the medical. Now that's what they come to the medical, because they want you to do something like this, or the medical professionals once again. You must be the medical assistant who is assisting this medical provider during this procedure. But if you have an idea how that works, it is so easy and it feels so comfortable. Can you imagine the medical doctor is asking you to bring these materials and you don't even know how they're going to place them, how they're going to utilize those? You feel like out place. You feel unease. Not knowing, probably the medical doctor is going to ask me to press here, to hold here, to put tape right here, or these clips right here, and I don't know. How do I do it? Or to try to roll this when they are holding the area. How am I going to do it? Here, you're going to have an idea, because that's one of the reasons why, we are in the medical. because you never know, something might happen. Okay, so before we move any farther with these bandages, we are going for a break, right? Take a break, eat something, breathe, check your emails, do something at home or wherever you are. And when we come back, remember 7:40, we continue with this chapter. And if we finish it up, then we have another chapter coming up. All right, so enjoy your break. See you 7:40.
Okay.
Thank you. Once again,
Thank
if
you.
you guys have any questions, when you return, ask me. All right. Take care then. Enjoy. Yeah. Para comer a comer. Hay padres que no comen la crema. La crema está un poquito más. Sí, no, como ya ayer estaba buena, pero para hoy estaba con un poquito fuerte. Bajar, comer, bajo. Sí, abierta usted. Los tamalitos tienen pollo y todo. Todo delicioso, pero, como te digo, le mandaron tanta cosa aquí. Todo se le da a unos chicos. Y ahora, creo que dejar. Todo, yo estoy escrito que lo vamos a hacer. Todo, ahora ya tenemos la otra grupo. Ya, tú me quieres. ¿Sabes? Fernando. Ser un jugador de expresión, caer bien, si juega bien, todo eso. Y no, quería ser modelo. Elegantísimo. Pero, y tiene contentos, y le dije, no, lo de modelar se demora 5 o 6 años. Pero te falta lo único, ya de cambio. Ya viene un proyecto más moderno y que estamos viendo. Y eso sí que hay. Uno que estaba viendo, ¿cómo se llama? Okay, so we are back from break. I hope you guys enjoy your break. Okay, so let's continue with these therapeutic procedures. Do I have you back?
Teacher.
Okay, thank you, Jenny. Okay, so we were talking about bandages and the different usage of bandages, very convenient, cheap to buy, and very easy to apply. So let's start with mentioning the types of bandages that are out there. So we have elastic bandages, those that stretch, of course, and easy to kind of move around the contours of our structures. So that is an advantage. So we can kind of roll it around any surface, any shape, and still we can get it to work. Some of them can be reusable, some of them non-reusable. So if we need something that needs kind of get more pressure of the part of the body that we need to apply these bandages, elastic bandages are the way to go. So there are another one that is called clean tie bandages, stretched but not elastic. So actually they, once again, you can tie it up, but they do not stretch much, meaning you cannot elongate them. So that's basically what it is. The other ones you can kind of stretch and make it longer, and therefore makes more pressure when you apply them. But these ones, not so much. Let's say that they are kind of semi stretchers. So that's basically what it is. Because this is morely like gauze. In gauze, sometimes you cannot stretch it much. So here we have some of them, different types. So whatever you're using in your office, that's the one that you get. So I believe that you probably are more familiar with this type who goes, or this one, and definitely this one, which is comes in different sizes, remember? These ones are more like clinical. You don't see them much outside. So that's basically what it is. So we have different sizes of the width and the length, because all depends where you're going to apply them. Can you imagine if you're going to apply these bandages to finger, to the toe? They need to be kind of not too wide, right? So then we will choose something like this or something like this versus your legs, your arms, your shoulders. Then we will go for the ones that are wider. So that's basically what it is. So they have different materials, different sizes, and we can use it for different purposes. Even though, the main reason that we do the bandages, once again, is for support and immobilization and mobilize the area because we don't want them to move. That's the reason why we got the bandage. You don't want something to move that you are kind of covering or protecting like an injured part of the body. You don't place bandages just because of the sake You just wanted to place it. No, we place it because we need it. Something underneath needs to be protected or immobilized or support or pressure. So that's basically how we utilize these bandages. And you see many people, that goes to medical centers or hospitals coming out with, bandages after, the medical provider has done some type of the procedure or the patient has gotten into some type of trauma. So that's basically what it is. Not much about these bandages per se. They're not going to ask you about the sites, the names, the types, but they're going to ask you how to apply them somehow, one type of it. So let's start talking about these tubular gauze. Once again, we're talking about the types of bandages. Cotton loose elastic fiber uses a metal tube for application. Now, these are very, very easy to apply because you don't have to roll them directly with your hands, your fingers on the patient's body part. You just have kind of a instrument or a device, so to speak, to apply it. It is a lot easier. So that's basically what it is. So we're gonna go over and then I'm gonna show you a video how to do it. This is very practical, very practical. Instead of kind of rolling something over the finger, and rolling and unrolling and all the stuff might be very troublesome for some, particularly if you have pain in that area, you fracture or you dislocate a finger or a toe. So moving it as you do in the procedure, can cause discomfort for the patient. Whereas if you use this particular device, the cylinder that you apply directly to the finger and start rolling it up, well, it makes this process of procedure a lot easier. So what we're gonna do is the patient, remember, it is ordered when the patient complains about having fracture of finger or a toe, or the patient dislocated. There are some issues with the finger and we want to immobilize. That's it. So the patient do not have pain as, the patient goes about everyday, activities. Because usually hands, particularly fingers and our feet, we use it a lot. Not to mention any other parts of the body, but these are the parts that, you need to walk, you need to move around, you need to hold things, to move things, to do things with your hands. So we're always doing it. But if you have an injured finger, you're not gonna be able to actually move much the hand. Actually, you can avoid doing anything with that hand. So that can limit us, particularly when you have to do some type of task or move some errands at home, do some chores. So it's very tough. So what is it that we're going to do? We are going to slide gently the applicator over the appendage. The appendage is the body part. See, my legs are appendages. My arms are appendages. My fingers are appendages. My toes are appendages. Appendage is something that is attached to the main frame, which is the trunk. Anything that is like appendages are the branches of a tree, not the main trunk is the branches. So our arms, fingers are appendages. They are attached to the upper part of the shoulders with the chest, the trunk, with the trunk initiates. So anytime that you hear appendages is something that is attached to a main frame. That's basically what it is. So once again, the tube gauze must be held in place to prevent sliding. You're gonna see the video because you're gonna kind of insert the tube, the cylinder in the finger or toe, and then around that cylinder, it is contain the bandage or the gauze, whatever you're gonna call, because it's a bandage made of gauze. So once again, instead of getting these gauze that you're gonna roll by hand, one layer over another layer, we are gonna just place something in on the finger or the toes, and then we're gonna hold it on the bottom part because that is where the bandage is gonna reach out. So you're gonna hold it, then you're gonna pull out the cylinder, twist it around, go back, go up, twist it, go back, twist it until you complete the bandage. So that's basically what it is. We're always gonna hold it on the bottom because if you don't hold it on the bottom, when you pull it up, then the bandage is gonna go up. So you have to kind of hold it on the base of the appendage of the finger or the toe. So that's basically what it is. Now we gotta make sure that, depends of how long this tubular gauze is for the structure that you're gonna be bandaging. Well, it gotta make sense, right? If it is too long, well, when we cut it out. Otherwise, we apply it completely. Most of the companies, they manufacture those tubular gauze with 3-4 layers only. So we don't need more because the finger is very small. So you don't want to go and try to put too many layers that not even going to fit the finger in between the other ones. So that's going to be very uncomfortable. So that is basically how it is. So we're going to watch a short video how to do it because it's a lot easier to watch the video and to have an understanding of what I just explained. Remember, we're going to have a cylinder that is going to be put inside the finger, but on top of that cylinder, we're gonna have a gauze, a bandage. And then we're gonna hold it on the base, the gauze, and we're gonna pull the cylinder out. Twist it on the point, on the tip of the nail or the finger, the distal part, put it back, hold it again, pull it back, twist it, pull it back, and so on and so forth. So let's watch the video because it makes more sense when you see it. If we were in class, well, it will be a lot different because it can be a demonstration for it. But here, we just have to play videos so you can have a better understanding of what I'm trying to explain it to you. So let's watch this short video just for you to have an idea. Mm-hmm. Good. Trying to just initiate this. Oh my God. Ahora no. Mm-hmm. Okay. Just trying to fix the video to the start. Oh. Okay, so here it is. Pay attention. It is a little cylinder, metal cylinder. Sometimes it's a plastic cylinder. It doesn't matter. that contains the bandage. So if you see right here on this upper part, you can see this bottom part, see the technician is holding the gauze. Right here is anchoring the gauze at the base. So when we pull this cylinder out to come and give another layer, then it will pull up if we don't hold it. So check it out.
I can't see nothing on the screen.
Can you guys see the video?
No, I can't see nothing.
No.
No, I can see it.
What do you mean no? Oh my gosh, this is not good. Can you see it now?
No.
No.
Oh no, this is now a little trouble because I'm placing it right there. I mean, I'm sharing with you this video.
Cut along the edges a little bit better. My weakness is getting the flies out of the container.
Can you see it now?
Nobody in my house knows how to do it. The first piece always turns into a nightmare.
I can't see nothing.
No?
No, I
Oh,
can see it.
this. Who can see it? No one? Oh, this is now it's a different trouble. Let me see, copy. Hold on. Hold on a minute and see where is it that it is not working. Trying to. Okay, I'm gonna do something different. Oh, this is totally different. Oh no. It didn't work what I was trying to do. Well, hold on, please. Okay, this is a different technique. No, this is not what I want. No, I don't have that specifically. I couldn't find it. Doesn't work. Well, I'm gonna send you the link and you can watch it because I don't know why, for some reason. I don't know why you cannot see it. Really, really. Because this is the only one that I have. Let's try one more time and see if you guys now can see it. It's something little different. Okay. Here goes bandaging. Can you see it now?
Yeah.
Yes.
Okay.
Yes. Just
Now,
the
can you
tape
hear
though.
it?
Yeah.
Perfect.
You might want to cut along the edges a little bit better.
My weakness is getting pies out of the container. Nobody in my house knows how to do it. The first piece always turns into a nightmare.
Oh, it's a good thing it still tastes good.
See how easy it is? Let's try it again so you can see what they're doing from the beginning.
You might want to cut along the edges a little bit better.
My weakness is getting pies out of the container. Nobody in my house knows how to do it. The first piece always turns into a nightmare.
Oh, it's a good thing it still tastes good.
That's it. So you see how easy it is just to apply these goals using this tubular technique versus rolling the gauze around the patient fingers because it's going to cause the patient more discomfort. That's basically what I'm trying to tell you. Okay, finally, I don't know what was going on with the video, but finally we got the chance to fix it. Okay, so this is the tubular. See, here are the images. You have to hold it right here by the base, but first you place the tube, the cylinder all the way down through the finger and hold this part of the base of the gauze and then pull it out, do a little twist, kind of twist, and then pull it back, twist it again and put it back, and this is the results. If you don't have the little strings at the end to tie it up, and keep it safe on the patient's wrist, like the video, you just apply tape right here over the gauze at the end. And that's it. You just apply tape right here and the dressing is going to stay there safe. So that's basically what it is. It's very simple. Once again, it's just that, we need to be familiar with. This can be very handy. You can buy it. You don't need to order it through Amazon if you have any problems at home. See, this can be utilized and useful for our daily situations. Something can happen, so we know how to do it. And you just get it in CVS, any of those large pharmacy chains. So that's basically how it is. Let's talk about this surgical turn. Now, once again, very easy. It's just going around and around, starting on the wrist, going around and around with this tape. So that's basically what it is. So there are different ones. So we're just gonna watch a video right here with this one so you see it. Once again, simple. I will tell you which one you're gonna be asked on the exam. But in the meantime, we just go over these videos so you can have an idea how they work. Okay. So let's see bandages, turns, demonstration, circular spiral. So here we're gonna see different, all the bandages that we have. It's just that I separate them, you know, so we can go over each one of them individually. So let's move on. This is the circular turn. This is the spiral turn, meaning, you know, it's the figure that you're doing there that changes a little bit, and we're going to see how it's done. Spiral reverse turn. This is one of the, it's a little complicated. Well, it's a little more complex than the others because you have to do a twist and go back and make certain type of shapes. So once again, he said, you have to choose this one or that one. All depends what you're gonna do, how you want them to look. That's basically what it is. The purpose is the same. It's just that they have different kind of designs, so to speak. So how you want to be, you know, placing this particular bandage over your appendage, that's basically how it works. Now, is it this works better than the other? No. There is one that is used to support the ankles that we're going to talk about next. That is very important that you should know. So that's basically what it is. So these are just styles of dressing. The most simple, it works just as fine. It's just that people always try something different to make it look a little nicer, so to speak. So here is the figure of a turn or dressing. Now, this one, you can start directly right here by the sole of the foot. So you can start running it up from here all the way and down here and here and here and here. Or you can start up here above the ankles and moving this way, going back, and see, it's like a number 8. So that's basically what it is. You will understand what I'm doing all this later on because that's going to be a question for your exam. So that's basically what it is. See, this is how it end up this particular dressing or bandaging. So again, let's watch the video because it's a lot more interesting and, well, you can see exactly how it's done. Okay, let's go right here at the video. And okay, for sure you're gonna see this one. As I can see it right there. Somebody says, yeah, professor, I have it. Okay, so let's start with this. Uh-oh, well. Pay attention, that's the circular, just very common one. And this dressing stretches. It's just showing there that here is when he's going to secure this end part of the dressing or the bandage with clips or with tape. That's it. It is done. Very simple. You're just rolling this all over the patient's arm. That's it. Or leg, whatever the case may be. Very, very simple. See, these are the clips. If you don't have the clips, you can use tape, remember? This is the spiral. Look at the little twist to it. This is the reverse spiral. This is the little one that is a little more tricky. Just twist. See? This is just for design purposes. Once again, either of these bandaging, just do the same work. They just want them to look a little nicer. That's basically what it is. Okay, pay attention to this one. See, this is the figure of 8, meaning the way that they use or the technique that they use to apply this bandage is in a figure of 8. This is a question for exam, okay? So they're gonna ask you, okay, so you're the medical assistant and you're gonna apply support to the ankle. This is, remember, the other bandaging or the techniques that we saw are in a long stretch part. You don't have an articulation there. So it is like right here within, the longest part, the body of the structure, the appendage. Here we are going to support an articulation, which is the ankle, or can be the knee, or can be the elbow, because this only works for articulations. So when you have a question, then you are going to apply a bandage for an articulation. Particularly, they're going to mention you're going to apply a bandage to a patient's ankle. Then immediately you know that the most recommended, the best technique for this particular articulation is going to be the figure of 8 bandage. Remember, all other bandaging that we saw, they are in a solid kind of a longer part of the articulate, the structure, the appendage. Here is to support an articulation. So that is the key. So you can learn how it's done. Once again, you can start from the sole of the foot, or you can start from above the ankle. Either or works the same because you're gonna use the figure of 8. So check it out. So this is it with this bandaging. See, it's very, very simple. You just have to have the technique. You just have to learn. Now, the common factor on all these bandages, not the purpose of it, is that they start in one side, rolling it up all the time in the same place, few times. Like they started here and they roll it up in this area like 3 times and then start stretching and going around. All of the other techniques use the same. They start first in the base, roll it up in the same space 3 to 4 times, and then kind of moving upwards. So that's how it's done. Very simple. Okay. Any questions about this bandaging? Remember, the one that you have to keep in mind for exam purposes is the figure of 8. And you're gonna remember this because they're gonna ask you to perform a bandage. Well, that's the question, right? You are the medical assistant and you've been asked to apply a bandage to a patient who has an ankle sprain or strain, whatever the case may be, or twist an ankle. Just think about that it is an articulation. No other bandages can work if it's not an articulation. That's basically how it is. This is the only one that works for articulations. Remember, articulations, you have 2 different structures kind of attached, and when you're gonna have certain movement, the other part they didn't have movement, so you can do any of the other bandages. Okay, so let's move to the next chapter, laboratory testings in the physician's office, because we are talking about medical clinical laboratory. Now, any questions before we move on with this chapter about, these therapeutic procedures? Anyone? It is simple, once again. Hopefully, you're never going to see this in your workplace. Most of the time, they have a nurse who do all these procedures. So you're going to be doing other things besides doing these procedures. But who knows? You never know. You're gonna end up with a medical provider who, is doing most of these particular procedures, and you might be trained to do them. It is interesting if you want to learn them. Definitely, it is interesting because time goes faster when you are busy doing procedures versus just being in the front desk or running around doing this and doing that. So if they do procedures, and not only that, when you work with a medical doctor that do procedures, your salary is higher because now you're doing something different. So that's basically what it is. So don't ask me how much, because I don't know, but I just know that you will get paid more because now you are doing procedures mostly, because that's what the doctors do. So basically, that's what it is. Remember that I mentioned before, if you work with a GYN doctor, then you're going to do procedures. You're going to do pap smears all the time. And if this medical gynecologist or GYN doctor is also an obstetrician, because most of them have a dual profession, dual licensing, well, then you're going to see those patients when they do sonograms for the fetus and other tests that they're going to do to the female that it is pregnant. So lots of stuff. So if you work with the gastroenterologist, also you're going to assist with colonoscopies. If you work with an urologist, you are going to do lots of procedures there. Male and female, reproductive system and the urinary system. So all depends where you're going to be working. But once again, you don't need to know like, oh, I work on this. Well, if you have experience, that would be nice, right? But they're going to train you because they're going to see your potential and you're a medical assistant. And then, so we don't have to train you, teaching you every single procedure out there because that will be impossible. We just give you the basics. So when you start working, then you're going to learn what they do over there. That's what I did. I learned lots of procedures with urologists, with gastroenterologists, with the neurologists, with the orthopedics, lots of stuff. So when I moved to my medical program, then I knew a lot of stuff because I start, from the bottom up. So that helped you a lot. And once again, the point here is that they're going to train you. They ask you if you want to do this, and then if that's what you want to do, then you will go for it. Remember, there are more money there. So let's talk about these procedures that are more, I'm pretty sure you're going to be doing this because these are very simple procedures when it comes to certain, in the office procedures like urine collection, blood collection kind of things. So we're going to go over some of the things that you are going to be performing, definitely. So let's talk about urine. When you start working, it's not just that you're going to ask the patient to bring you some sample of urine. It's not just that. Some of the time you have to evaluate the physical and the chemical aspects of the urine. It's not difficult, believe me. If you are asked to do it as a medical assistant, it's because it's something that is very, very simple to do. So when we evaluate the urine physically, it's like you've seen it. You have given the patient the little container, the little cup to go to the bathroom and bring you a sample. That's basically what it is. That's something that you are going to be doing as a medical assistant all the time if you work in, with a general doctor. Some of the doctors that don't do general medicine, probably they're not going to be collecting urine if they do a specialty. So once again, I have some of my students that working with neurologists, with orthopedics. So they don't need to collect your urine. That's part of your PCP. So that's part of your primary care physician. That's what PCP stands for. So that's basically what it is. So these are routine tests. Now, as soon as you receive the urine from the patient, you have to document if that is part of the test that is being required, being ordered by your medical doctor. So then you have to look at the urine as the patient bring it to you. And what are the things that you have to check for? Color. Color is the first thing that you have to look at it. So normal colors of urine has a variety of colors. This is a range of colors. It's not just one color and still is considered normal. So instead of reading this part, let me show you the images, the pictures of the urine, how they look like, and still is considered normal. You are not sick. You don't have a disease if you have the colors of the urine in this way. So look at the urine. Now they mean something dietarily. So if we are not drinking enough fluids, the less fluids that you drink, the darker your urine is gonna be. So that's what I want you to learn. I don't want you to learn all these names. Why? Because probably you're not gonna see it. You're just gonna see that it is clear yellow. Oh, this is kind of light yellow. Oh, this is dark yellow. Or we sometimes call it amber. So that's basically what it is. So you're gonna be looking at the urine because this is the physical examination of the urine. So starting from my left, or the ones that I'm gonna mark right here, this is how it works. So my left, meaning for you, probably is your right. So let me check this out. So this first one, so this is number one. Oh, let's put number one right here. So it's a lot easier to be marking this urine, better for you. So this is number one. It says light straw. We call it light yellow. And when you see the little format when you have to record or document the color of the urine, it says light yellow, dark yellow. So you just follow. It's the same as light straw, dark straw, light amber, amber, and dark amber. So that's basically what it is. So here the patient is very hydrated. So when we see urine that is kind of water, very clear, this patient is very hydrated. That's basically what it is. As it moves forward, see, the colors start changing from light to dark. So that's basically what it is. So you here, you're not diagnosing, you're not doing any of those. Other things that you're gonna look for it and is that it is transparent. So you place the urine right here on the background, you place something dark, and you're gonna be able to see the other end through the urine. So that's when you know that this urine is normal. Normal color, not normal that there has nothing in there. No, normal color. So that's basically what it is. So if you have your urine and you can see through it, that is called transparent. That's it. And then you look at the color, whether it's very light or kind of darker, darker, and darker. You just mark it. So that's basically what it is. And you look at the images right there on the car. Oh, this looks like very dark. This looks like very light. This is like middle. So you just places yourself right there. So that's basically what it is. It's very simple. So once again, you're not going to be asked to diagnose. You're just checking the color. This is the physical examination of the urine. Now, the scientific part of what is it that your urine is this color is because what is it turning kind of yellow? Because we have a pigment that makes up hemoglobin. And when hemoglobin breaks down in the process, releases this particular yellow pigment that is called bile, and then is going to turn the urine yellow. And the more pigmentation that you have and less liquids that you drink, darker your urine is going to be. So that's basically what it is. Now, later on, we're going to learn when you have an infection or when you have a condition, how it looks like. Well, that will differ from all the other colors that we saw. And not only that, you're not going to check just the color. You're just going to check the smell of the urine. Because the urine has a typical kind of little acid alkaline flavor to it, smell to it. But if you have a medical condition, your urine is going to smell different. I'm going to go over that and you will see it. Because part of the evaluation of the urine, once again, physical. What you see, what you smell. So that's basically how it is. So yes, you have to open the little container, the cup, the urine cup, open it up and kind of get a little close. Not like you're going to go there and smell it directly. No, let this vapor come out because the urine is warm, because the urine has been recently brought to you, and that's when we do the evaluation. And as soon as you open the can or the cup or the container with the patient brought you the urine, you open it up and the smell starts coming out and you're gonna capture that smell. So that's how we do it. Yes, that's how medical assistants get trained. So that was the normal part. Light yellow. It says right there, pale yellow, you see, or light yellow. Then amber up to dark amber. So remember, as it goes, as the patient drinks less fluids, the urine is going to be darker. Check your urine when you drink lots of fluids. Check your urine when you get up in the morning. You haven't been drinking anything during the night because you were sleeping. So when you woke up, you go to the bathroom because usually when I go to the bathroom, then check your urine. And your urine is going to be darker than during the daytime. Why? Because during the daytime, if you're drinking lots of fluids, the color of your urine is going to change. So these colors doesn't mean that the patient is sick. Remember, it's just telling me that you are or well hydrated or not so hydrated or bad hydrated. So those are the things that we do physically. Now, if it were normal, once again, it has to do with medication. So medications, there are some medications that change the color of the urine. So don't get scared or don't tell anything to the patients when they come and says, wow, oh, what's going on with you? Look at your urine. Don't ever make these type of comments. Why? Because the patient, number one, have you making it worse. You just normally act. Oh, here's your urine. Sure, not a problem. What is that? Oh, you sick. Look at that. Remember, these comments are not, um, acceptable. So basically, that's what it is, because we tend to say things. I'm telling you, seen many people, as soon as the patient brings some specimen and sample that was ordered, they start making comments over that. No, refrain yourself from making any comments. That is not professional. So don't do it. So once again, might be that the patient is taking some medication, nothing wrong with the patient or urine or the kidneys or anything else. It's just that the medications are turning the urine that color, like green, like reddish, like kind of foamy, like greasy. So don't, because you don't know what's going on. Remember, you leave that to the medical doctor. Our job as medical assistants is just to collect specimen. Remember what I said one couple of times? Less is more. Less is more. The less that I open my mouth and say something, believe me, the better that we go. Because whenever we say something, we might have to explain it to the doctor. And that's not going to be a good idea. It's not going to be a nice confrontation, believe me. It could be that the patient actually have a medical condition. Remember, it's abnormal color, but then we just collect the urine, record what were findings. We don't know anything about it. And if the patient asks, because the patients are also curious, wow, yeah, I don't know why my urine is that color, what it is. You know what it is? Because they think that because you're working there, you know everything. I said, no, has to be sent to the laboratory, and when we get the results, then the doctor is gonna let you know that. You're not gonna tell, oh, no, I have no idea, I'm not supposed to be talking to you. No, you don't go to the stream either. But you give them a correct answer. I don't know, ma'am. I don't know, sir. Or I don't know, Mr. and Mrs. Smith. We need to send this urine to the laboratory, and when we get the results back, then the medical doctor is gonna evaluate and is gonna tell you. Okay, it's gonna let you know. Thank you. That's it. Very nice. So the patient got the answer. We don't know. It's not that I don't want to tell you. Even though if I know it, I'm not gonna tell you anyways, because that's not my job. So that's it. That's how it works. See, the urine's appearance, meaning this is the physical exam, clear or transparent. That is it. That's when it's normal, it's clear or transparent. You put something on the back that is darker, of course, and you're gonna be able to see it through. So that's clear or transparent. Now, if it is normal, it's due to different reasons. You have a bacterial infection, right? That's what it says right here. You have some red blood cells there. If you have an infection and you're bleeding through your urethra or somewhere else through your urinary bladder, then, well, what do you think the color of your urine is going to be? So remember, sometimes the patient comes to the office not because they feel in pain. They have some symptoms, right? They go to the bathroom, they uh, go to pee, go to move your bowels, whatever it is, number one, number two. But we're talking about urine, and they see then, the urine is a different color or has certain smell. Because for them, that's not a normal smell because they've been peeing their entire life. And then suddenly they smell it differently. They see it that looks differently. So, hello, they go to the doctor because we get a little scared, right? A little nervous. So you're going to go to the doctor. So this is what you have to pay attention to it. Because once again, the patient comes over the office. Hi, I need to see the doctor. Sure, what seems to be the reason? I check my urine and my urine looks and or smells weird, different. So, okay, no problem. No more questions because you shouldn't be asking questions anyways. And that's it. You collect that information. Now you have to be prepared because you're going to be collecting urine from this patient. And remember, if these patients are going to be waiting for the medical doctor, the patients are going to go to the bathroom where they are waiting. So you should provide them with a container for urine. Hi, Mrs. Smith. Because most of the time, bacterial infections are common in females more than in males. So, I'm sorry, Miss Smith. Please let me know if you want to go to the bathroom because I need to collect some urine, okay? You are not diagnosing, you're not doing anything. You're just moving ahead. That's how it works. Because remember, next time the doctor is going to call the patient, and the patient is being waiting in the waiting area for 30 minutes, 45 minutes, an hour, maybe more, and the patient already went to the bathroom, but the medical doctor orders urine. And you knew it because the patient was complaining about urine. So you have to collect it. So once again, that's what these classes are all about. This is not just for you to pass the exam, but also to know what is it that you're going to be doing in your workplace. If you don't know how to handle it and you just kind of like a robot, whatever they put you to do, you're just going to do, you're not going to go anywhere. You're not going to move any farther. You're not going to get promoted. Your salary is going to stay the same. Probably they're going to replace you with someone else. You have to be on top of everything. Hey, can you ask this? Can you collect some urine from this patient? Give the patient. Oh, I already collected. Wow. If you tell me that, I'm gonna be like, hey, this is the person that I want to have in my office. This patient was complaining about chest pain. You're not gonna do an EKG. Definitely not. That is going over the top. But you're gonna let the doctor knows immediately. Dr. A, I have a patient who is complaining about chest pain. It's about, this is the chart, 40, 50s, probably is having some problems. Probably the medical doctor is going to ask you, when I'm seeing this patient, can you perform an EKG on this patient? That is what we need as a medical assistant. Not just someone who's doing whatever they ask you to do. No, you have to be ahead of the game. So if you have red blood cells right there, you're going to see your blood tinted, kind of reddish, probably red. Well, you're not going to know about the changes in pH because, well, it's going to be, well, yes, you might notice the changes in pH and the pH because, once again, how dark, how concentrated the urine is as well. So that will be also specific gravity. But it will be a little more difficult, but the smell will be different because it's whether too acid or too alkaline. Crystals. Now, you're not going to know anything about this because these are calcifications. Too much calcium, too much sodium, too much potassium. So you're going to have a little crystals, little little rocks because of the concentration of these minerals that might come out or proteins that might come out in your urine. You're not going to be able to see them, but, you know, probably when, remember, this is abnormal findings, but you're gonna kind of, figure it out when you see something very, very abnormal, like, the urine is hazy or cloudy or turbid or milky or foamy. This is not normal urine. Hazy, cloudy, turbid, very, very similar terms. So what it means is kind of, you cannot see through it. So you see, when the day is cloudy, you're not gonna see the sun coming out. It's kind of darker, right? So you're not gonna be able to see much. Hazy is the same. It's kind of very foggy kind of thing. So you're not gonna be able to see through. Turbid is a little darker, but you're not gonna be able to see it. Milky, well, it looks like milk. It's whitish. Foamy, it looks like, oily. So when you see those things, then you know that this urine is not normal. Something is going on. Has nothing to do with being hydrated or dehydrated. Here, something is going on. This is the time that you're not going to tell the patient anything. You're not going to make no comments. Wow, this urine stinks. Oh my God, what's going on? What you ate? Wow, look at this. These comments are unacceptable, remember. I'm telling you all this because I'm seeing a lot of stuff, people making comments, and guess what? These patients goes to the medical doctor and they tell. And remember, they're not gonna tell just a simple, question or comment. They're gonna add it to it. They feel offended. They feel threatened. So again, you say something that they don't like it, they're gonna tell the doctor, and they're gonna make you feel bad. So you don't want to be in that situation. So once again, this will be different colors that shows that your urine is not normal. Another part of the physical evaluation of urine, others. Remember that I told you. Now, others can be for many reasons: medications that you're taking, foods that you're eating, infections that you might have, a medical condition like diabetes. See, if you have diabetes, it's not that you have high blood sugar. That's a totally different issue. You've been diagnosed with diabetes. The smell of the urine with a person who has diabetes is sweet. Smells sweet when you open the little container or the urine cup. These little papers start coming out and you smell something sweet. If it is a bacterial infection or an infection, a bacterial infection, it's going to smell really bad. Smell like rotten fish, like rotten eggs. So you know immediately that something is not good with this urine. Now, foods can also cause the urine to have some type of smells and does not imply that the patient has a medical condition. I'm going to tell you two foods that cause your urine to smell really bad: broccoli and asparagus. If you eat asparagus, particularly, because I have, and I went through a very bad experience when I was younger, because I went to the medical doctor because my urine was smelling horrible. So then I told my dad that I was, went to the bathroom and that my urine was smelling really bad. So my dad took me to the doctor and the doctor orders a urine. But before that, the doctor asked questions. So they ask personal questions if I'm taking medications, if what I'm been eating. When ask me what I'm been eating, well, guess what? I told the medical doctor that the night prior, um, I have eaten some asparagus. So the medical doctor smiles and says, "You don't have anything to worry about it." But then still, we're gonna collect some urine and we're gonna send it to the laboratory. But I think what you have is the asparagus causes some release of some gases. And those gases causes the urine to smell really bad. So I got a little better. So I'm telling you that you should not make any comments in front of your patients, regardless of anything, just in case you have to kind of transfer the urine. It's not because you're going to evaluate the urine, because sometimes the patient just bring the urine, you ask them to leave it over the counter and or on the counter, and then they leave, right? Sometimes you might have to do other things, and you doing your job. So don't make no comments, because you never know what it is. It might be medication that they are taking for something else. So that's basically what it is. But one of the things that I'm telling you from now is that if smells really bad, it might be an infection as well. But then, see, when I went to the doctor, I didn't have no burning sensation on urination, which they asked me at that time. But I was young and still didn't know anything about medicine. So, I just answered things, but they asked me those questions. And they asked me other stuff, and then I was like, "Oh, wait a minute, what's going on right here? Something is going on with me." But then, if they have make any other comments, probably, I will be very scared about it. So don't say anything. Just go by the flow. Smell it. Hold your breath, as I have done many times. Because remember, you cannot have a mask if you are checking, the physical appearance of the urine, if you are checking the odor of the urine, the pH, the specific gravity, because those are the physical evaluations of the urine. You're not going to be able to wear a mask. How are you going to smell with a mask? You're not going to smell exactly what it is, because that's to cover, your nose. So you're not going to be able, this is like a barrier for you. So, but you have to wear goggles. That is a different issue, because there might be a splash. But if you're doing these type of evaluations, remember, you're not going to be able to wear a mask, but you have to hold your breath, as I did many times for many other things. So that's basically what it is. Now, what is exactly the smell of normal urine? So it is very difficult to explain that, because, what is normal for you might not be normal for me. People have different smells. Are not talking about urine that is being decomposed. We're not talking about urine that is being, already uh, spoiled. That's not urine that is kind of very fresh within the first 5 minutes after boiling, and you collect the urine. This is how it's going to smell. It's kind of aromatic. It is a very distinctive smell. But already when it doesn't smell like that. It's just kind of difficult to explain. Nobody's going to say, "Oh, no, smell like this exactly." No, it's just have an aroma. But it's not that strong, but it's not kind of very light. You smell it. But if it goes beyond that smell, that is when you need to make sure that, you visit your doctor. So that's basically what it is. Any questions about appearance, color of the urine, odor of the urine? Because we're going to enter these situations. Now, a possible question from here when you in your exam is if a patient has diabetes, what would be the smell of the urine? What will be the odor of that urine? Remember, it's gonna smell sweet. Sometimes they stated fruity, like fruits, right? That's basically what it is, a sweet fruit. That's basically so fruity, sweet. Check for those answers because those are the ones that you might have there. So here it is. Oh, by the way, here it is, the smell fruity. So if your urine, because this is abnormal urine odors, abnormal, and you definitely going to, you're gonna know that something is not right. And we are not talking about urine that has been spoiled, meaning a urine that you have it for over 2 hours on room temperature or outside, that urine will decompose very fast. So let's see the smell, fruity or sweet. Reasons what you might have the smell of your urine like this. Starvation. What is starvation? You're not eating. Anorexia. You force yourself not to eat. That's a different issue, right? Uncontrolled diabetes mellitus. See? So they're not going to ask you about starvation, anorexia. No. The answer will be diabetes. They're not even going to write uncontrolled. Uncontrolled diabetes, as the word implies, means that you are not taking medications for your diabetes. So your blood sugar is sky high. So that's basically what it is. So fruity, sweetie, odor on the urine, diabetes. That's it, because diabetes is one of the most common conditions. And the smell is particularly because, remember, you have high levels of glucose. So when you pee, what is it that you're going to have in your urine? Well, all the components of urine plus sugar. That's what smells like that. It's gonna smell like ammonia. You know what is ammonia? This is when you use ammonia, this chemical that you use for disinfectant, you know, it's very strong. Go through your nose, and that is, you know, I start sneezing. I mean, with the ammonia, real one, not the one that you see or you smell from the urine. So, urinary tract infection, UTI. So when you leave your urine for a long time, you don't put it in the refrigerator after 1 hour of collection, then the urine is going to spoil. Then you're gonna smell this particular odor. Now, if it is foul odor, now that is like a rotten eggs, rotten fish, that is a bacterial infection. I add something else, not just bacterial, it might be fungal infection as well. So bacterial, fungal infection, foul odor. Very strong, bad odor. Believe me, you will have to cover your nose for sure. Okay, any questions about anything that we covered today, or in particular urine? So we're going to be talking about this. We're going to talking about blood and certain tests that we're going to be doing. Because remember, that's the purpose. Some laboratory procedures that are very common in medical offices. Any questions?
No, not at the moment.
Okay. So now, once again, you don't have to memorize everything. You just have to be aware of, whenever you're working, and depends on who you're working with and what test they order, just to make sure that, you apply whatever we cover right here, and, do your best. That's basically what it is. You will learn as you go. Remember, this is about practice, 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 and more practice. Nobody's going to learn all this just because you give them a lecture. No. You can pass the exam, everything else, but still, when you come to real work experiences, it's a different deal, okay? But you have the basics. And remember, you're going to have someone there who's going to train you, someone who's going to show how to do things, but you have to be willing to learn and learn new techniques, because sometimes the techniques that we use might not be the most appropriate. I learn every single day do different things. See, I teach these classes for many years.